All the healthcare workers in the Nigerian society are all wonderful people. The doctors and the nurses. Great people you are, wonderful people you are. But from experiences, even from my practical experience and many other experiences of citizens, there is need for the Nigerian nurses to wake up and come to the best behavioral pattern of their profession. The same thing for the Nigerian medical doctors, especially in the public general hospitals, where government is the one that pays salaries. Although in the private hospitals, these complaints of the citizenry that is unpleasant against the nurses and doctors may actually not be there. But majorly, these complaints are for the nurses and doctors in the Nigerian general hospitals. Patients don't like the way you nurses behaves to them. So also, patients don't like the ways majority of doctors behave. But I know that we live in a peculiar Nigerian society where things are not done properly like the way you see in other foreign nations that make our people to go and sort for health care in those foreign countries. But I want all of us to know, both the nurses and doctors, that the people abroad made their own country what it is. They bettered that place, they developed that place. They cannot come to Nigeria here to better our own health care for us. It is you, the nurses, who studied nursing in Nigeria, the doctors who studied medicine in Nigeria, that will help to make sure that our health care is good. Yes, how many people from US, England, China, Japan have you seen come to Nigeria to talk about receiving health care here? Because they know that you, the nurses and doctors, that also find yourself to gravitate from your position to become ministers of health or even medical doctors of hospitals, general hospitals, you have not done well. You refuse to follow the international best practices. You can imagine a nurse telling a sick patient, "Am I the one who told you to be sick?" Or telling a pregnant woman, "Am I the one who pregnated you?" Being harsh with bad behaviors, not even doing well. Those at night duties, instead of them to be helping out patients in the night that they are in the duties, they will go ahead and be sleeping. Patients will even knock at their door, "Nurse, nurse, nurse." Something is happening. The nurses will, if at all they will come, they will take like 20 minutes. Even by so doing, the patients could have even died. What type of nursing is that? The same thing for medical doctors. You are seeing a patient. The patient will be in great challenges. They will call you on phone. Instead of you to listen to them, to talk to them patiently, you either will not pick the phone, or you will even tell them you will call them back and you will never call back. What type of a doctor are you? Is it about money you are busy chasing up and down? Remember, as a nurse or as a doctor, you are a human being as well. And when you are sick, you may not be able to treat yourself. You will need another doctor or another nurse to cater for you. If those people behave the same way to you, how are you going to feel? If you look at the foreign land and the health care they get there, the nurses are very gentle. They speak to you with kindness, so that kindness can even make you well quicker than you expect. Even the doctors are very humane. But our nurses and doctors here, you think about the money. We know money is important in terms of salary and allowances. Okay, government should listen to you and help more. But that first behavior that you swore to nurse patients to life, to help patients to come and live good life, is what you should concentrate on. Concentrate on it, because that is the greater glory you will get, both for human beings appreciating you and for you also being appreciated by God. For Nigerian medical health care to be good, it is those of you who studied medicine, those of you who studied nursing, that will make it a better place. American president will not come to Nigeria to make Nigeria's health good. So also a Chinese president or an England president will not come to Nigeria to make our healthcare sector to be good. I therefore want to use this opportunity to say that our nurses and doctors, for God's sake, help Nigerians, help them to get their health care, because that is what you studied and that is what government employs you. Some of you have private hospitals and yet you work in government hospitals, and you allow government hospitals to suffer and your own private hospital flourishes. It is not right in the sight of God and even human beings. Do your private hospital business. Give great time to those who come to the general hospitals in the public and the society, and they will be happy. And a lot of you decide to say you want to travel out of this country. Yes, when you travel out of this country, are you going to carry your whole family to go? Are you not going to have your brothers and sisters who are here? So what you are going to travel to do in other countries, you can start doing them here by being sacrificial, because those people who made their countries great in terms of healthcare, they sacrificed for their country to become better. That is why a Nigerian today will say, I want to go to England, I want to go to America, I want to go to elsewhere to get healthcare. Those people made that place to work. You can make Nigeria's healthcare to work by contributing your own good quota as a nurse to the patient, also as a doctor to the patient. Having seen this video, please share it so that it gets to all the nooks and crannies of society, so that those who have ears will hear and they will start to implement the good things that has to do with all our collective effort. My name is Andrew Ajayi, the Radio Senator. God bless you. You can follow me on Twitter, Andrew Ajayi at the Radio Senator. You can also see me on YouTube on Andrew Ajayi. Also go to my Facebook page and like it. And also when you see this video, please share it all to get to everyone, because our collective health care is what we sought for as far as this video is concerned. God bless you as you do.